Joining me now is Gavaghan, a senior registrar in adult psychiatry at a hospital in South London. Good evening to you.
Good evening.
Gavaghan. What do you make of Jeremy Hunt saying that you are playing politics at the expense of vulnerable patients?
I mean, I think I would echo what Jeremy Hunt has just said in that we also, as a body of doctors, are devastated. This is a devastating day for this country. There is absolutely no question about it. This hasn't happened in 40 years. We've been fighting this for a year. Why? Because we know that what is happening at the moment, what the government are proposing, is going to place our patients at risk. What I would like to point out to the public is I'm not just a doctor. I would like to put myself in the position as a patient. I'm a patient that goes to the NHS as well as being a doctor. I do not want, as a patient, to go into the NHS that is underfunded, understaffed, and we know we are grossly understaffed at the moment.
But going on strike doesn't help that, does it? I mean, you're going to have hundreds of thousands of operations and appointments cancelled. It's a 5-day walkout, 5 consecutive days, putting patients at risk.
And I agree, it's absolutely not wanted by anybody. You're right, it is a complete inconvenience and it is going to place patients in positions of pain, waiting for operations and so on. And all I can say is I apologise as a doctor, but I think as a doctor we have a duty, as doctors, to stand up and say no if we recognise something is unsafe.
Do you not have a duty to your patients?
Absolutely. And I'm also a patient. So I have a duty to say that this contract, the junior doctor's contract, was based on the premise of this 7-day, truly 7-day NHS that David Cameron talked about in his election manifesto. There is no funding, there is no plan, there is no model. You cannot stretch an already understaffed NHS to 7 days without staff, without funding, and at the same time impose a contract on the understaffed doctors that are working within it.
If that was the case, why did the BMA initially in July recommend that junior doctors accept this contract? And as the Department of Health says, the BMA must be the first union in history to call for strike action against a deal they themselves negotiated and said was a good one. You got concessions, you got a good deal.
So I think that's inaccurate. And this idea, and this is going around the media all the time at the moment, that the BMA agreed. No, the BMA did not agree as a body. One person within the BMA, maybe more than one person, but certainly not a unified... Yeah, one person.
But he was the junior doctor's representative.
But the BMA as a body did not agree. They did not agree to this contract. So one person agreed and endorsed it. We then had 60% nearly of doctors say absolutely no. And many doctors that voted yes, I can tell you because I hear from them every day, they're my colleagues, they voted yes because they thought at the time of Brexit everything was in confusion. They voted yes on the basis of what else do we do? There are many people that voted yes, actually, that do not feel this is fit for purpose. There needs to be a complete rejection of this contract. It needs to be absolutely forgotten about and started again.
But it's not going to, is it?
But it has to.
Jeremy Hunt is not going to give up on this contract.
Well, if Jeremy Hunt doesn't give up, I think what we need to remember is Jeremy Hunt talks a lot about mid-staffs, right? Probably the worst crisis in the NHS, right? He talks about being a patient advocate. What Jeremy Hunt is presiding over right now, in my opinion, is going to be a national mid-staffs because there are no staff, there is no funding, and yet the government are pushing through a 7-day, truly 7-day NHS. It's not going to work.
But isn't a 7-day NHS in the interests of patients?
Yes, and we as doctors would love better weekends. So you know we work 24/7, you know that. You use the NHS, I'm sure, I don't need to explain that. But if we're going to include non-urgent care in weekends, where is the money? Why isn't the media questioning this? We need to be asking why.
And it has been questioned. We talked last week about the report into the 7-day NHS and where the funding was coming from.
And his own civil servants said no to it.
But I wonder where you think the public support is going. Do you fear that public support is waning? And the polls seem to suggest that public support is waning for you because this industrial action is going on for so long. And also because of the leaked WhatsApp messages that revealed that pay grievances, which is the issue that the BMA has tried to say this is not about, but pay grievances were the only red line.
Yeah, I don't buy that. I'm sorry. You know, I mean, we go back again. You can't stretch 5 days worth of doctors. Already stretched. There are huge gaps in hospitals across the country.
But is this contract about pay? Is this contract dispute ultimately about pay, which is what those leaked WhatsApp messages seem to suggest?
There are parts of this contract that are about pay, sure, because Jeremy Hunt wants to count weekends as sort of weekdays. He wants to take our weekdays up until 9 in the evening. That's part of it. But the bottom line, we must not forget, it's simple. It's so simple that anyone out there can see this is not going to work. There are not enough doctors. You know, there are 3 doctors on surgical takes covering 6 doctors. Do you think that's safe for patients?
Well, the Department of Health would say that the
unsafe.
highest number of doctors are being employed by the NHS.
The Department of Health is saying 10,000 more doctors. Tell me where they're coming from.
You're not saying
It's nonsense. It's nonsense, I'm sorry, but I don't buy it. There aren't any doctors. Where are they getting them from? None of us know about these 10,000 doctors. 10 billion going towards the NHS, that's a drop in the ocean. You know, we're told about 8 studies about the weekend effect. Well, there's plenty of research that shows it doesn't even
So where
happen.
does this end?
I think it ends when the government sees that this needs to be another U-turn. They've U-turned on a lot of things in the last year, let's face it, a lot of things. This is not going to work. They need to U-turn on the 7-day NHS until they get adequate evidence that shows they can fund it, they can staff it, and they need to show that to the NHS staff. Because otherwise we can't work in that system. We are going to put our patients at risk. And yes, strikes are not the right thing to do, but we have to draw a line.
OK, Lauren Gavaghan.
Thanks for having me on. Bye.